Okay, the number of attendees is settled down. We're going to go ahead and start the meeting now. Tonight's topic is colic, what to watch for and how to reduce risk in competition. Our presenters are Dr. Pam Hess and Dr. Kay Gunkel. I just want to say as a reminder, this is part of our Let's Ride Natrac seminar series. Every fourth Wednesday of the month, January through October, we have talks, and we'll be having another talk on what to expect at your first Natrac ride. March 24th, I believe. It's March 24th, I believe. With that, Dr. Hess, Dr. Gunkel, will you take over?
Alrighty, thank you so much, Bill. Thank you. Welcome everyone to the Natrac webinar. So we've got quite a few visitors. We're going to run through a slide presentation for you, and we'll be able to take some questions as we go along. So I believe what Bill wants you to do is enter any questions into the Q&A box, and we'll be happy to stop and answer some questions as we go along. So I have Dr. Kay Gunkel here with me. Hopefully there are some of you joining us that know Kay or know me or both of us, and we're happy to introduce this topic to you and take your questions, and I hope you all feel a little more comfortable after this presentation in how to take care of your horses and how to recognize a colic and what to do if that happens. So take a minute and look at this screen. This is a screen, a picture that I use when I'm teaching my undergraduate students about colic. So take a minute and look at that and see if you can figure out what's going on there. What is that? What's happening in that picture? So some of you worry a lot about your horses, that you're doing something wrong if your horse would experience a colic. And what I want to explain to you is that this is your horse's gastrointestinal tract. What is this? This is an accident waiting to happen. This is a guy riding his bike, looking backwards at an open car door, a person getting out of their car, not looking where they're going. You can see what's going to happen, and it's not going to be pretty. So this is an accident waiting to happen. And to a certain extent, our horse's gastrointestinal tract is like that. It is not the best designed thing ever. You would think that it would be easy enough to keep your horse. You put food in, the poop comes out, everybody's happy. What could possibly go wrong? Easy peasy, right? Sometimes it's not that way. The horse's GI tract is actually a perfect storm of bad engineering, of terrible plumbing. There are large capacity tubes going to small capacity tubes. There's hairpin turns here and there. There's huge long portions of it, volumes of material that are not tacked down in any place at all. There's constrictions and turns. It's prone to clogs. We call them impactions. It's prone to overflows. We call that reflux or diarrhea. And it's very sensitive to changes in materials. We all know that you shouldn't change your horse's feed abruptly because they have a hard time adjusting to that. So all of that tells us that the horse's gastrointestinal tract is prone to upset. And it's not usually anything you've done. It's not anything your horse has done. After 32 years of practicing veterinary medicine, I'm here to tell you that sometimes bad things just happen, and horses colic. So we're going to talk to you tonight about colic. Colic is abdominal pain. It doesn't specify where the abdominal pain is. It's like your horse is lame. It doesn't say that the horse is lame in the knee or in the houses. That most is medical action. Simple treatments, a shot of Banamine, to take the horse for a walk, things like that. Most of them resolve pretty quickly and easily. Some colics are more serious, and they do require advanced medical care and sometimes even surgery. So the way I like to approach educating my students when we teach about this, first we're going to talk about the behavioral signs of colic. the things that you see the horse doing. And then we're going to talk about the physical signs of colic, the things that you and your veterinarians are going to observe and measure about your horse. And then we're going to talk about the different things that can go wrong in the horse's body that make the horse experience abdominal pain, the causes of colic. So most of you probably already know many of these behavioral signs of colic. The horse goes off feed. He may appear depressed. Now you have to be careful with a depressed horse. Be sure to get your thermometer out, because sometimes you may think that your horse is colicky because he's not eating. He could have a temperature of 104. So make sure that you take his temperature. He could be pawing, he could be rolling. This is flank watching. This Palomino horse in this picture is watching his flank. Some horses will do that briefly, abruptly, even violently looking at their flank. Others will stay like that for 30 seconds, just staring at their flank. Some of the horses will be restless. One of the more common things a horse will do is stretch out. They will look like they're parking out and stretching out. A lot of times, to me, this is a sign of a horse who has an impaction colic. Sometimes the horses will drop their sheath down a little bit and a gelding will act like he wants to urinate, but he really won't produce much urine. When you see the horse doing that, that could be a sign of colic developing. And of course, we all know that a horse laying down might be a sign of colic. What I do when we have a horse who's laying down at maybe an inappropriate time, like at feeding time, we don't expect our horses to be laying down. Go ahead, get them up. That's the first thing I do. If the horse is laying down and you don't think he ought to be, get him up. If that horse lays back down again within a couple of minutes, he's colicky. He's not taking a nap. He's colicky. Some other things that horses do is the Flamin Response. This is the picture of the horse with the upturned lip. That's the Flamin Response. Some of them will grunt and groan. That's not really common. Rolling, some horses will sweat. And of course, either kicking out or kicking up at their abdomen. Some of these horses will be so painful, they will throw themselves to the ground quite abruptly. So you really need to be careful that you're not getting in their way. So those were the behavioral signs of colic. Now we're going to talk about the physical signs of colic. Are y'all with me out there? You can hear me okay? Nobody's hollering, so I think we're okay. So the physical signs of colic: either too much gut sounds or not enough gut sounds. Either one of those can happen. If I had my choice, I'd rather have a horse with too much gut sounds. A silent abdomen is kind of a scary thing for me. I like to hear gut sounds. Some of the horses will bloat. You'll see this in their flank area, kind of just behind where the back of the saddle would be, right near their hip bone. You'll see bloating of the abdomen there. Most Natrac riders know how to take a heart rate and a respiratory rate. These can be elevated with colic. They don't always have to be, but an increased heart rate in particular is a sign of increased pain in the horse, perhaps. We all know how to do CRT, capillary refill time, where you put your finger on the horse's gum, you blanch the gum. The pink color should come back in 1 to 2 seconds, no more than that. So the horse should normally have nice pink mucous membranes like you see in the picture there. If they're bright red, that's not good. But it's worse if they're purple or muddy, kind of chocolatey color. That's not a very good sign. That makes me very unhappy. So let's talk about gut sounds for a minute.
Yeah, can we go back? I just had a few comments on that last slide.
Yep, for sure.
So heart rate, one of the places I'd like to say is 40. 40 beats a minute is pretty normal. So if your horse's heart rate is greater than 40 beats a minute, that could be an increased heart rate. Capillary refill time, increased capillary refill or decreased capillary refill time, it's taking longer to fill. What that's showing us is that the horse is shunting the blood to the abdominal organs, and that's then shutting it down up in their gum area. So that's why we want to look at capillary refill time. Mucous membranes, there's what's called a toxic line, and that's where you're looking at the teeth, and sometimes you'll start getting a red line just right there around the top of the teeth. So that's another thing to be observant of, is a toxic line.
Good point. That's extra redness around the teeth. Yep. Mm-hmm. Very good. Thank you. Okay, let's see if I can get my slide to advance. There we go. This is one of my favorite words, borborygmus. It's just gut sound. Borborygmus is more fun to say. So veterinarians typically listen for gut sounds in 4 areas. At a ride, you may just see us listen in one area on both sides, right and left of the abdomen. But typically when we're examining a horse for colic, we'll spend more time and we'll listen to more areas. We want to see regular churning sounds of fluid and ingesta moving around in the colon and in the cecum. So veterinarians get very used to the normal amount of gut sounds that you have. In the picture on the left, the X that's up higher generally reflects the area of the small intestine, which does not produce as much sound. So we don't always expect as much sound in the upper left of the body. And then the lower X there on the left side is the colon. That's the left colon. And then on the right side, the cecum covers a lot of that area. So if a horse is very gassed up in his cecum, you can hear even tympanic or sounds like a drum that's very even musical sounding. And of course, we like to hear a lot of gut sounds normally, and if we don't hear any, that's going to be a problem. So these are the 4 areas that we tend to listen to in the gut.
Pam,
Yes, ma'am.
so as a judge, you know, I tend to just listen on one side just because of the speed of getting horses through. But if I don't hear good gut sounds on that one side, then I'll go to the other side. But I know there's judges out there that will take the time to do both sides. As riders, I feel like it's very important too that you get your stethoscopes out and you listen to your horse's gut sounds so you know what's normal for your horse. And then I feel like decreased gut sounds at a ride is the first indicator of fatigue in the horse. And that's why it's just so important to keep these horses eating so that their gut sounds stay moving forward throughout a ride.
I do the same thing, Kay. When I usually start on the near side or the left side of the horse to do my vet check, and I'll drop my stethoscope down kind of in between where those 2 X's are there. And if I hear good gut sounds instantly, that's a 0 for me. That's a normal horse, and I don't bother to listen to the other side. If I have to listen for quite a few seconds and I don't hear anything, then I start to get a little more concerned, and I'll do a little more thorough checking of the gut sounds. Yep. So now we're going to talk about the intensity of abdominal pain, because it's all about how much pain is the horse in. And of course, you have to have some criteria to speak about that. So I just like to do something simple: mild, moderate, or severe. So if the horse has mild colic, he paws lightly, he may do some flank watching, he may stretch out, he may even lay down. But he's not sweating, he's not anxious, he's not throwing himself on the floor. This is a horse that isn't too scary to watch. You may not even be sure if he's colicky or not, but it's not alarming to observe this horse. So the moderate horse, he is exhibiting more pain. He paws very firmly. He may dig a hole where he's standing, pawing so firmly and intently. He may kick up at his abdomen, or he may kick out. He may do a lot of flank watching. He could circle around. I've even seen horses bend their hocks in their knees and kind of walk in a crouching manner. It's halfway between laying down, but they're not down, they're not up. Some of these horses will lay down for a while, and some of them will be sweating. So this is the horse with a mild or moderate amount of pain. When horses begin to get like this, you need to be cautious around them, because when your horse is experiencing more and more pain, he is not going to respond to you with his normal good manners that he might. And you can't blame him for that. He's got his own problems when his belly's hurting. So you just need to begin to be a little more cautious handling your own horse, that you might get hurt inadvertently. The horse with severe colic can be a danger to people. He stamps his feet, he kicks out, he will throw himself violently to the floor. He will not care that you're jerking on his halter or really trying to keep him up. He may not care that you're walking him. He may throw himself to the ground, even if you're walking up and down the driveway. He may be sweating an awful lot. He may be flaring his nostrils. So I don't know if you can see that. I just got a note that my internet connection was unstable. So hopefully it won't be leaving on me. Hopefully you can still hear me.
Pam, could you stop your video for a little bit? That might help your bandwidth.
Stop my video. I don't have a video on. The PowerPoint, you mean?
No, your camera video. See if you can pause that. Your screen was lagging about 10 seconds there.
Okay.
We'll
and I can see my husband's in the other room, the TV. We have that now and then. So usually it comes back in a few seconds. But so I took my video off. Let me know if you want it back on. You can still hear me.
We'll try again in a few minutes.
Okay. So, so this is a horse with a severe amount of pain, and we need to be pretty careful about that. And we'll talk about managing these horses with pain in another moment. So what to do until the veterinarian arrives. So you want to take your horse's vital signs. You probably you know as NATRC riders how to take the heart rate and respiratory rate. Hopefully you have a thermometer in your emergency kit if you're at a ride or at home in your barn. And if you have a stethoscope, you want to listen for gut sounds. Very important to monitor manure production and urination. Urination is particularly important after a ride. In times when your horse has been really exerting himself, if he ends up having a muscle problem, tying up, he could have very dark urine produced. And if you can even catch that in a Dixie cup, I don't care what you catch it in. If you see him peeing and it's anything but yellow, go ahead, catch it in a cup because the veterinarian would want to look at it. Likewise, save any manure that the horse has produced. Just pick it up, set it aside, and just save that in a muck tub or whatever for the veterinarian there. So what else should you do while you're waiting for the veterinarian to arrive and look at your horse? Stop feeding him. Take hay and grain away. It's not necessary that he graze if you think that he's colicky. Just stop feeding him for a little bit. Water's not real important to remove. Most colicky horses under most circumstances will not drink water anyway, and so it's really not a problem if water's hard to remove, but I don't usually instruct people to go taking the buckets out of the stalls. I would beg you not to give him any medication until your veterinarian arrives or until she gives you instructions over the phone. Kay, do you have any comments about this in particular?
Well, we just have to remember that Banamine can definitely mask symptoms. And it really kind of depends on that horse. You know, once I have a client that I consulted and worked on their horse for colic, I might advise that client differently than a brand new client that I don't know the horse.
Exactly, and I would do the same thing. I would say though, if I'm already in my truck and I'm driving to your farm, I would say don't give the horse Banamine 30 minutes before I get there, because it takes 45 to 60 minutes for oral Banamine to work in your horse. And I'm unsure of what I'm looking at when I get there, if we're right in the middle of that mechanism of action of that drug taking effect. When I was in practice, all my regular clients did have Banamine at their homes. And after talking with me, if the horse was not violently painful, if it was a mild colic, I would often instruct them to give the horse Banamine. But if it was a severe colic, I really preferred that they wait until I get there. I can assure you that there's not a colicky horse in the United States who goes to surgery without having 1 or 2 doses of Banamine. So it doesn't prevent us from seeing the horse's serious colic, but it does prevent us from being able to evaluate a mild case of colic, and that's always important. So
and I was going to say one thing I've experienced too is that people have oral Banamine, but it might be expired by 1 or 2 years, and so then you're like, well, should I give it? Should I not give it? And so then if the horse isn't responding to this expired product, it just makes it even harder to diagnose what's really going on.
So you always should have fresh product, and just remember that 1 tube of Banamine is about 1/3 to 1/3 of the cost of just a veterinary farm call out to your farm. So go ahead and pitch it if it's old and get a new one from your veterinarian. So this is kind of a pet peeve of mine to talk to you about should you hand walk the horse? Should you continually walk him? So a lot of older people in particular tend to think that it's important to walk the horse. It's helpful to walk horses. It's helpful for humans to walk when they're recovering from a bellyache. But it is not helpful to walk a horse to the point of exhaustion. I've heard many clients tell me that we walked that horse for 18 hours straight and saved his life. That's nonsense. It's just flat nonsense. It's not necessary to exhaust yourselves or exhaust the horse. And the fact that the horse survived that colic was serendipitous. It wasn't because you walked the horse that long. So it's okay to let the horse lay down if he has to. There is not a veterinary clinic in this country that walks horses nonstop while they're hospitalized. The horses lay down if they need to. Sometimes you cannot prevent the horse from laying down. He'll throw himself down. These horses get themselves cast frequently in their stalls because they can't stand up. Nature just tells them they have to get down and roll around. Horses are not going to injure anything in their gastrointestinal tract by rolling. The reason they're rolling is that they already have pain in their abdomen. They already have an impaction, or most likely, if they are violently rolling, they have a displacement or a torsion in their intestinal tract. They're not rolling and they're not going to hurt that. So I had one client several years ago that got his arm broke because they were so forcing the horse to walk that they walked behind the horse, tapping his butt with a crop all the time, and the horse reached out and kicked him and broke the man's arm. And they had already been walking the horse for like 8 hours. So let the horses lay down if they have to. Put them in an area where they're not going to get wrapped up in a fence or hurt anyone. And if you cannot keep the horse walking, let them lay down and wait for the vet to get there. Kate, do you have any opinions about that, Kate?
Well, the concern I have is if they're rolling a lot, you know, them hurting themselves, and I've even done where I've taken like a hay bale and kind of pushed it up against them just to kind of give some stability. And sometimes that makes the horse feel more comfortable.
Yeah. But basically, if they're going to get down, you can't stop them from getting down. And just don't feel like you have to drag them around walking them for 18 hours straight with a case of colic. And follow your veterinarian's advice on that.
Well, and a lot of times too, if the horse is that bad and you don't have a vet coming, maybe that's the time to get them in the trailer and get them to a facility that can take them. And, you know, people always worry, well, what if the horse goes down in the trailer? And if they go down in the trailer, just keep driving.
Yeah. Yeah. Don't stop and get them out at a gas station. Yeah, that would not be good. Okay. If there's no questions, then I don't see any coming up on the Q&A board. So we're going to go ahead and talk about the causes of colic. So this is going to get into the more medical structure of what causes colic. So I like to view the causes of colic as to various physiological things that can happen in the horse's body that will cause the pain to develop. The first one, and the most common one, is stretching of the intestinal walls. Usually this is gas. Sometimes it can be fluid or food material, but this is your gas colic. This is the common gas colic that you just got a big stretched out ball and it's full of gas, and the horse needs to pass gas, the horse needs to have the gas quelled in his intestines. This can be very, very, very painful, but this is also very common, and so it's something we deal with a lot. So stretching of the bowel wall. Then you come to where the intestine is actually displaced or completely twisted, and think of displacement as a partial displacement. And if it's a full displacement or a twisting, then it gets really tight, and this causes a tremendous amount of pain. By the time, sometimes a displacement can fix itself. Sometimes a horse rolling around can fix this. Sometimes the therapeutic trailer ride can fix a mild displacement. But by the time it gets twisted, you're going to be out of luck. You're just going to take a surgeon's hands at an abdominal surgery to fix that. Then this is kind of one that we've been taught through the years about disruption of the blood supply. This can happen because the intestine is completely twisted. It can also happen because of a blood clot. This is the strongylus vulgaris,
Uh-oh, Pam disappeared.
What's that?
Oh,
Can you hear me?
there we go. I can hear you now.
Okay.
It was cutting it out.
Yes, I'm getting a note that my internet is unstable and my video is still off. So fortunately, we don't see very much bloodworm anymore, but you can certainly see intestinal strangulation and cutting off of the blood supply. Somebody
I know.
Yeah.
I was going to say at CSU, I've had some of the techs that work there that are still seeing foals, especially that have colic because of a blood clot due to worms. And a simple wormer would have saved that horse's life, that foal's life.
And I have a slide where we'll talk about that a little bit more too with foal colics. Somebody had asked in the questions that were sent to Jamie or Sarah earlier about how do horses with Ulcers act. Deep ulcers in the stomach, particularly glandular ulcers, can cause colic. Ulcers in the right dorsal colon can cause colic. These are usually pretty mild colics, and they will not be mistaken for a twisted intestine. That kind of doesn't happen. And then a little bit more of a rarer one is peritoneal pain. And the peritoneum is the lining of the abdomen, and the intestines lay in the abdomen up against that peritoneum. If it's inflamed or infected, that can cause problems for the horse too, and he'll experience pain. There's not too many other mechanisms of having pain, but there are a lot of causes that specifically relate to those mechanisms. So that's what we'll go into next. I always like to explain to people what's common. I don't want you to be thinking that your horse is a zebra when really he's a quarter horse or an Arabian. Very, very common, where none of us are riding zebras out there. So we're not gonna think our horses, we're not gonna jump to the uncommon causes. We're gonna think about the most common causes. And I want you to have some appreciation for what's common and what's most common causes. We talked about gas colic. That's probably one of the simplest and most common ones that we see. 80% of colic cases are mild, are simple, and the horse is going to get over them pretty quickly. So gas colic is the most common of all of those. Then we have temporary motility problems. And this can be some of the ones that you'll see at a ride, I think. Has either spasmodic motility, which means hypermodal, too much sounds, or they can even have a loss of intestinal motility if they're on the toxic side. We see impaction colics. I think everybody's pretty familiar with constipation or an impaction in a horse. This is the kind of colic that I feel the most confident in diagnosing, because I can do a rectal exam on that horse. I can put my arm in and I can feel the impaction with my hand through the wall of the rectum, feeling the intestine and the abdomen. So that is a very accurate and specific diagnosis. This little baby foal here in the picture, he has an impaction, but that's a meconium impaction. That's that first sticky poop that the foals have. They need an enema to pass that. And this guy can't think about nursing. He can't think about walking. He can't think about doing anything but pooping. He's got his mind under his tail. And then gastric ulcers. Foals, of course, have a lot of ulcers, but we recognize more and more that our adult horses have ulcers also. So here's just a picture for you of what an impaction looks like. The one up over here on the upper left, that's an impaction in the pelvic flexure. And that is what I can feel with my hand when I do a rectal exam on the horse. I can feel that impaction, and I can be very confident in diagnosing that. This one in the diaphragmatic flexure, that's all the way over here, really almost up to the horse's elbow, up against the diaphragm. Nobody can feel that. You can only guess at that. So we can't really know if our horse is having that kind of impaction. But fortunately, if they have small colon or they have a pelvic flexure impaction, we can feel that. Less common causes of colic, and Kay mentioned wormers, important for foals. In intestinal foreign body, foals get roundworms or ascarids, and anything from a weanling to a long yearling can have a significant infection with roundworms. Those of you, I don't know if we have people joining us from California or Texas, even Florida. You guys get sand colics, and veterinarians experience and hearing sand in the abdomen can hear that. I practiced for 3 years in California and learned to do that. If I'd spent my whole career in Ohio, I would never believe that could be done. Also, unfortunately, in California, they get stones that form in the intestines, enterolists, or stones that form inside the intestinal tract. Also less common, fortunately, is a displacement or a twisting of the intestine, and then intestinal strangulation and entrapment. I'm not going to spend a lot of time on these. If anybody wants to talk about these afterwards, we can certainly go into more detail. I do want to mention anterior enteritis, and this refers to inflammation inside the small intestine. This is a sick horse, and they're colicky, but they're not colicky the same way as a horse with a twisted intestine. But sometimes these are hard to figure out. Does this horse have a standard colic, or does he have anterior enteritis? The key to these horses is to take the horse's temperature. They often have a low-grade fever, which is not common in other colic. Horses also have a huge amount of reflux. When the veterinarian passes a stomach tube to these horses, you can get a 5-gallon buckets times 2, times 3, times 4, just fluid siphoning off of this horse's stomach and small intestine. So it's a very serious disease, but it doesn't go to surgery, but it is a serious illness. And then, of course, what strikes fear into the heart of all large animal veterinarians is diarrhea, otherwise known as colitis or enteritis. Again, these horses can be a little colicky before they break with diarrhea, and you don't know it. And something's wrong with the horse. He's a little bit colicky. He may or may not have a low-grade fever, and 8 or 12 hours later, he'll break with a screaming diarrhea. And then you know your answer, what you're dealing with there.
Pam, we had one quick question from Abby about what kind of things will cause a gas colic.
Oh boy, I wish I knew for sure. It can certainly be a change in diet. For instance, going out onto grass. This is the time of year when a lot of horses who are on snow now, they're going to start going out on March and April spring grasses. Some horses that are not used to that will get colicky with gas colic. For some of them, it'll be a change in grains or even a change in the amount of exercise. I have one horse that lives in my barn, an older Haflinger mare, and she gets gas colic frequently. And this mare is the biggest tooter you ever saw. This mare passes gas under her tail constantly. She is the most tooting horse I've ever seen. She also is a frequent coliker, very mild, always responds to a regular dose of Banamine, and I think she gets frequent gas colics. You know, they say better the fame than the pain, and it's better to be a tooter than not. But of course, horses can't throw up willingly. And so when a horse gets gas in their stomach rather than their colon, they can't get rid of that. And so that can cause a horse to be colicky too. So some people think that changes in weather will cause a horse to have gas colic develop. That has never actually been proven. It's somewhat of an old wives' tale, and we could probably argue back and forth on that for a long time. There was just a recent study that was looking at that, and they really weren't able to show that it did have anything to do with changes in barometric pressure or weather. Kay, what are your favorite causes for gas colic?
Well, and you know, that change of the weather, I think that has more to do with, you know, the horse getting too cold, not drinking as well, and ends up being like an impaction colic. And, you know, it's associated with the change of weather. And I think they can get gassy, like you said, the most eaten grass, you know, green grass, the green, that's, you know, they can founder from eating green grass, but they can also get gas colic.
Yeah. And that's very horse dependent. There's a lot of differences in that. This is just a picture here of the enterolists that form in the intestine. These are hard like rocks. These are not impactions that can be broken up with mineral oil or fluids. And if your horse, does have an enterolith, they're a little difficult to diagnose, and they only happen really commonly primarily in California and places out west like that. Some of the biggest veterinary hospitals in the country can see these on x-rays, but this horse may be a frequent coliker, as these stones kind of roll around in the intestinal tract. But then when they lodge in this spot where they can't get any further, then they're going to cause a serious intractable pain, and the horse is going to go to surgery to have it removed. I see there's a question about diarrhea there. With the large intestine inflammation that results in diarrhea, once the diarrhea happens, are they out of the woods? Does the pain go away? So I was fortunate to do my residency at UC Davis in California, and also spent a year at Kansas State and taught at a veterinary hospital in Oklahoma. And we saw some of the most serious diarrhea cases that happen as they would get referred to us in the teaching hospitals. And I got to tell you, diarrhea just really scares me in horses. If it's serious, when a horse has pipe stream diarrhea, if it lasts for more than 1 day and that horse starts to get depressed, it may not go away. Diarrheas in horses can be short, or they can last for 2 weeks, and the horse can lose 200 pounds in a week and run up a hospital bill of $6,000 in that amount of time. So if the horse does get diarrhea and he squirts a little diarrhea for 6 or 8 hours and then he feels better, you got lucky. Once the horse develops a really serious, like pipe stream diarrhea, they usually don't get as colicky. The colic phase is sort of in the early phase of that, maybe the first day or two, but then the intestinal cells are so damaged that it's very hard to get those horses over that diarrhea, and they may need intensive care therapy for 2 weeks after that. So most of you will never see a horse with diarrhea like that. I hope that you don't. But if you have a horse that has intractable diarrhea and is losing a lot of fluids, if that horse starts to get depressed, you really do need to have your veterinarian come out and see that horse. I didn't hear that comment.
I was just going to say that just in general, diarrhea in horses is not good. So if your horse has diarrhea, call the vet out.
Yeah, it's really bad. Okay, uncommon causes of colic. You can read the screen there. I'm not going to spend a lot of time on this because I want to make sure we have time for your questions. One here I do want to mention is blister beetle toxicity. I see we have 25 participants. I don't know how many of you are in Texas, Oklahoma, California, those kinds of places. You have blister beetle out there. I live in Ohio. I am not going to see blister beetle here unless they shipped the alfalfa hay in from Kansas or Oklahoma or someplace. Blister beetle occurs on the edges of alfalfa fields where the hay is grown, and they are actual little beetles that the horse ingests, and even a horse eating 2 or 3 of these beetles can make him very sick. If you are buying your alfalfa hay and you live out west in these areas, you need to buy your alfalfa hay from an experienced hayman that knows how to avoid packaging up blister beetles in the hay. These beetles are dead, but that doesn't matter. They're still very, very toxic. I saw a lot of these when I lived in Oklahoma and worked at the veterinary hospital there for 3 years. They don't usually kill horses. They can, but they don't usually, but they make the horses pretty darn sick for quite a few days. So those are uncommon causes. So most of the time when your horse is colicky, he's not going to have any of these things, except if you live out west and you're feeding alfalfa hay, I'd be cautious about blister beetles. Okay, so Kay and I wanted to talk to you a little bit more about what you can do at a Natrac ride, and then we'll talk about this some more at the end. I've got a little bit more information to tell you about different types of colics. So what can you do to prevent colic at your Natrac ride? Get your horse used to traveling. Don't expect to throw your horse in the trailer for the very first time to go someplace and put him in the trailer and take him 400 miles to a ride. Get him used to traveling. Know that your horse travels well. Not every horse is cut out for this. Some horses get very anxious, very stressed out. Get your horse used to traveling and know that he's okay with it. Bring your own hay and grain whenever possible. It should always be possible for you to bring your own grain. Try to make it possible for you to bring your own hay for as long as you're going to be away. Water, not usually necessary to bring your own water, but some of you probably do. If you can, that's great. Most horses won't care. Other horses will be extremely finicky. I'll put in a word for not feeding only electrolyte spiked water. I don't care really what your horse drinks, as long as he drinks. If you take away the fresh water and you only allow the horse to have water that is spiked with electrolytes and he decides he doesn't want it, then he's not going to be drinking. That's the worst possible scenario. You want the horse to drink water. So I want to tell you a little bit about Frog Pond in the Allegheny Mountains. So I used to used to compete in the Alleghenies when we used to run some Natrac rides up here in Ohio and the Alleghenies in New York. And there was they called Frog Pond. It probably was about as big as a 10 by 10 stall, and it wasn't super deep, but if they got in it deep enough, they might get in it up to their elbows. And the horses loved that muddy hole in the ground, and they would paw, and it was muddy and it was horrible. And every darn horse would stick his nose in there and drink and drink and drink. They loved the water. I think it was fed by a spring, because there was always water in the Frog Pond. So it just reminds me that I don't care what they're drinking, within reason, of course, but it's most important that they just do drink. And everybody who rode in the Alleghenies knew that if you could get your horse to Frog Pond, he would drink there. Even though the water looked muddy, the horses really loved it. I see there's a question about assuming your horse does travel well, what's the longest you should travel in one day? I think that is a well-placed question for my in the next slide or two, so hold that thought.
One comment I have is just getting the horse to drink at rides is I really like to make sure that I have a fresh bucket of water ready to go, so when you get back to camp, they dive into that water to drink it. So you know, that doesn't have a lot of hay fell in it, that it's not hot from sitting in the hot sun. But that almost always, when you get back to camp and you take your horse to the trailer, they want to drink. And so make sure that they have a good clean bucket of water to drink from.
Yeah, and that's a good point, Katie. Keep it in the shade so that it's nice. They will like it when it's cooler. Don't be a fair weather rider. You're going to come to some rides and you're going to be riding in high heat and humidity. Unless you scratch. But you need to practice a little bit under the competition conditions that you'll be riding in. I know some of you struggle, you're going to a ride that is hilly and you don't have any hills at home. It's just mud and sand where you live, and it's not rocky terrain. But practice if you can. Condition your horse to do some work in the hotter part of the day, because particularly if you're an open rider, you're going to be coming back at 3 or 4 in the afternoon sometimes, and it's hot and humid. And if you have only ridden your horse at 9 and 10 o'clock in the morning, and he's not going to be prepared for that. It does take some conditioning to get the horse used to the heat and humidity. And for you too, it takes some conditioning for you to get used to that also. So here's the question about how long is your trip that Christian had asked about. So there's a lot of different opinions about this, and we could probably get into some very interesting conversations about this. Do you stop or don't you stop? I know people who take their horses out of the trailer every 4 hours, take them out for 10 minutes and then put them back in and go. I know people who put the pedal to the metal and haul the horse for 11, 12 hours straight and barely stop. And they just want to get there and then get the horses out of the trailer. I'm kind of in the middle of that. I have done both. I was at a ride in Virginia one time years ago, many years ago, and my horse got a respiratory disease. And he was coughing badly and he was sick, and I needed to get him home. And I took that horse out of the trailer every 4 hours, and I let him drop his head and drain his sinuses and his throat and his trachea. And I stopped for like 20 minutes every 4 hours, and I got that horse home, and he was actually healthier when I got him home than when I put him in the trailer. But most of the time I'll haul long and I'll put him in the trailer and I'll go. I've not had very much luck getting my horses to drink in the trailer. I don't personally give them water in the trailer, and they just laugh at me when I put a bucket up in front of their nose when they're in the trailer. They're not very interested. Some of you may have better luck in getting your horses to drink in the trailer, and I'd be interested in those comments about how you handle this. One of the most important things that you can do, though, is to keep your trailer as cool as possible. You probably may not realize how warm the horse's body will make that trailer. So you want to have as much ventilation as you possibly can have, and get the horse there in as good a shape as you can. Any other comments about that, Kay? No comments. Okay, we'll move on. Okay, so you think something's wrong with your horse. Is it colic? What should you look for? We talked about taking the vital signs. Normal temperature is less than 101.5. Truthfully, most of your horse at rest during the day in the barn is going to be less than 100. At a ride, it's going to be different. When your horse comes off the trail, he could have a much hotter temperature, particularly if it's very hot and humid, but it's important to get him cooled down. Take the horse's heart rate and respiratory rate. There's the normal numbers for you. Monitor his appetite. We talked about urination. If the urine is anything but yellow, catch it in a cup or anything to have the veterinarian look at. If the horse has urine that looks like coffee, your horse has tied up. He's got myositis, exertional rhabdomyolysis, and that's a serious condition. That horse needs treated by a veterinarian for that. Somebody asked a question about taking walks. Should you be sleepy with sedative? Walking is good and helps. Okay. Okay, so we're going to talk a little bit about the diagnosis of management with colic, and then I'll be done boring you with all this stuff. So we're going to talk about what the veterinarian is going to do with your horse when she gets there to treat it. Banamine, Buscopan, Rompum, or Dermosidan. These are the Bible for treating horses for colic. Just about every horse in the world gets Banamine. Most veterinarians are using Buscopan now, which is a bowel relaxant. We actually use it for a lot of different things. Most horses will get a painkiller. If your horse receives any of these types of treatments at a ride, of course, your horse is going to be taken out of the competition, but that's okay. The most important thing is to take care of the horse. We're not worried about the competition anymore. We want to take care of the horse. The veterinarian may pass a stomach tube, like you see here in the picture, may put some mineral oil or other substances down the stomach tube for the horse, and the veterinarian may do a rectal palpation. And in worst possible scenario, the horse would get all these things, including IV fluids. Even at a ride site sometime, all of these things can be done to see if you can help the horse and get him on his way to feeling better. If the horse does not respond to those treatments, if he has severe pain that is unresponsive to all of those good treatments, that might indicate that your horse needs surgery. So this is when your veterinarian is going to ask you, do you have insurance on this horse? What is your level of expenditure for money that you are going to pay to treat this horse? Because we're thinking he may need surgery. So the veterinarian is trying to think, what does this horse have? And is it an indication for surgery? If it's a little bit displaced, maybe the horse can get away without it. If the horse has a twisted intestine, if he has, like down at the bottom here, this purple volvulus strangulation, there is no amount of walking and no amount of Banamine that's going to, the horse is either going to taken to surgery and fixed if he can be, or the horse is going to be euthanized. Those kinds of things you don't know until you open the horse up at surgery what he has. So they're going to be using all the indicators to trying to decide, does the horse need surgery or not? Severe and intractable pain is a reason for surgery. And if the horse is not a candidate for surgery for financial reasons and there's no insurance on the horse, then that horse needs to be euthanized. High heart rates are a pretty solid indicator of pain. Poor blood flow, no gut sounds, when the veterinarian does the rectal exam on the horse, a really distended bowel inside the horse that you could feel with your hand, distension of the abdomen. All of these things are a sign that the horse needs surgery. One thing that might not be is if the horse has a really large amount of reflux, greenish fluid coming from the stomach when they pass the nasogastric tube. If the horse has a lot of reflux, that might indicate that that horse has that anterior enteritis, and that is usually treated medically. Once in a while, some of those horses get put on the surgery table because they just can't get the pain to go away. But most of the time, I would say 95% of the time, the horses are treated medically. So surgery may be indicated for all of those reasons. If your horse has a fever, if the horse has liver disease, if he has diarrhea, those things mean the horse does not need surgery. He needs medical care. So I don't know if any of you in our audience have ever had a horse have to have surgery. It doesn't happen very often. Most of our colics with colic surgery. If your horse doesn't have surgery, and this is a picture of a horse at surgery, remember I told you there's large sections that are not attached to anything. This is the horse's large colon. This is the pelvic flexure here at the bottom. It's all laying out on a table, taken out of the horse's belly. That's a live horse. So it's pretty incredible. It's no wonder that thing can flip and twist around, huh? So horses that have surgery, more than half will survive. About 70%, could be 80% in some areas. For a year or two, they do have a higher risk of having another colic episode and needing another surgery. Once they get past a couple of years, they get past that extra risk. So the cost of medical management can be several $1,000s, but surgery usually costs in the neighborhood, I would say in my area, probably $1,000 to have a horse have colic surgery. By the time it's all done and you're putting the horse in a trailer getting ready to go home, it can be more than that if the horse has complications. So take-home messages. Sorry, flipping the slides here. The horse's GI tract really is an accident looking to happen, my friends. Most of the time when your horse colics, most of the time you are managing that horse perfectly well. It's not your fault. It's not something you did. The horse's GI tract is designed horribly, and it's amazing they can live at all. So we're thankful for the good health of our horses, but sometimes things do go wrong. But it's just because of the nature of the way the horse's GI tract is made. So there's a list of things that you can do to try and keep your horse healthy and safe, all the things we talked about, keep the parasite burden down, use electrolytes sparingly, use more in hot, humid weather, but don't force your horse to have electrolytes. All of these things can help you get your horse through a colic episode. Oh, let's see, I think there's a question there. What does a blood draw show before going into colic surgery? So this sounds like maybe someone had colic surgery and they did blood on the horse. Colic surgery is a huge metabolic event for a horse. They're going under anesthesia. They're a very large animal, and they're going to be checking things like kidney function, liver function, white blood cell, red blood cell count. Also electrolytes can be critically important when the horse is going under anesthesia. Some horses who have had colic will have kidney disease, and that means they have to have extra hydration and extra care even after surgery. So pretty much everybody does some blood draws on the horse before surgery. And they'll do a lot during surgery too, by the way. They'll draw arterial samples to check the horse's oxygenation level to make sure that the horse is healthy under anesthesia.
Well,
okay.
And then they also do that stomach tap, you know, where they tap the stomach, and that one will really tell, you know, is this horse a good candidate for surgery or not too. So those are all, I mean, wonderful. We're lucky we have CSU University right in my backyard. So all those things can be done prior to taking the horse to surgery just to see if they're a good candidate before spending that kind of money.
Yeah. Yeah, they almost always have a belly tap, and that's a little sample of fluid that's taken from the bottom of the horse's belly. They get a little fluid out of the abdomen, and they want to see if that horse has contamination in the abdomen, if he has a lot of inflammation in the abdomen, can help with the prognosis for surgery as well. Stephanie had a question. Once a horse has had colic surgery, what's the likelihood of them having a recurring colic episode or needing surgery again? We're going to say we're not talking about broodmares here. Broodmares have unusual circumstances, particularly when they have a foal, of having large colon displacements in the first couple of weeks after having their foal. So not talking about broodmares. If a horse definitely does have an increased chance of having colic again in the first 1 to 2 years after surgery. Some horses will form adhesions, inflammatory kind of sticky places in the bowel that will cause them pain. Some of them will be bad enough that the horse will need to have surgery again. But if the horse can get past 2 years or so, they can live a normal life, and the risk every year goes down more. But in that first year or two, those horses do have a higher incidence of colic.
Pam, we have a number of messages that were in the chat window and that are kind of ahead of these others. I'll read those off. The first one was from Kimberly. Horses that don't drink water on a trailer ride may drink warm water and rice bran with meal in it. It's more of a comment. She says that's what she does when she gets to a stop. Another person said Mary's mix of rice bran water is offered that when she stops. Let's see. The next question, when I hauled from Texas to Kentucky, we watered the horses every time we stopped for fuel, potty breaks. We brought jugs of water from home. My horse drinks like a champ most of the time.
That's
these
good.
Seem to be more comments. Let's see. There's a comment. It's when you said the price of colic surgery. Of course, when you gave a dollar amount, it was completely garbled. So it's, I know in Denver, they say at Littleton Large says colics surgery starts at $8,000 and goes on up from there. What did you say in your area colic surgery would be?
In my area, we usually quote people $8,000 to $10,000. I've had people spend $15,000, especially if the horse needs a lot of medical care after the surgery.
All right. That clears out the chat, and so you can go back to the regular quick Q&A screen.
I do see quite a few questions open in the Q&A. Do you see those, Bill?
We have 4 open messages in the Q&A.
Okay.
Starting with Chrissy.
Okay, so Chrissy Knight said earlier, mentioning insurance, I have a policy on my mare. Would it be advisable to give my vet clinic the policy info to have on file? Yes and no. If you're traveling with your horse, obviously they will not be the ones treating it. It would certainly always be a good idea. They should know that your horse is insured. Truthfully, what's the most important is you need to have the name of the claims office and the insurance adjuster on the horse's stall door or with you if you go someplace with the horse. Really what they need to know is the horse insured and what's the phone number I call. And it's all pretty much handled over the phone these days. Nobody's going to be looking up a policy. Make sure your policy is current. I've had some very dicey situations where somebody had a policy payment due and they didn't mail it, and it was very close to a cutoff date, and sometimes that can be when your horse decides to get sick. So having the name and the phone number to call for emergency when the horse colics is the most important. Okay, and then let's see. Here's a question. I'm unsure about when to use electrolytes. I thought if gut sounds were poor, you were supposed to give electrolyte paste, and it seems endurance riders often give electrolyte paste. Some guidance on this would be appreciated. Kay, do you want to field that one?
Yes, I am definitely an advocate of electrolytes, but different horses have different needs for electrolytes, and it all depends too on the environment that you're riding in. So this is a huge subject, and I'll be glad to email back and forth with Kristen. The plan is to try to keep the electrolytes in their system before their gut sounds get bad. I tell people that electrolytes is kind of like having oil in your car, that you don't want your oil to run low or you're going to start running into problems. And so you want to make sure that your horse goes into that ride with, the electrolytes, sodium, potassium, and chloride are the main three at good levels. So, putting them in the mash the night before, putting it in, something in the morning. And then I do carry electrolytes on the trail, and it really just depends. Like my black Tennessee Walker requires a heck of a lot more electrolytes than my half Arab does. So every horse is going to be a little bit different, and depending on their conditioning, depending on what the environment is that you're riding. I used to love riding in the mountains when it was nice and cool. She didn't need very much electrolytes, but if I'm down in the New Mexico desert, she's going to need a lot more electrolytes and a lot more work on trying to keep her cool.
Okay, good. And then Kay will let you field this one too if you want. Beet pulp. Does having that extra moisture of beet pulp in the gut help keep it moving during competition and help reduce the risk of colic from impaction?
I'm a beet pulp advocate as well. I know some people don't use it as much. Some people don't like to use it at all. It kind of depends on the horse, and you have to make sure that that beet pulp is soaked, and you're not ever giving beet pulp that hasn't been pre-soaked, because that in itself can cause an impaction. But I really do believe that you are filling up that bowel with a moisture and a good fiber source to help keep that gut moving forward throughout the day during a ride.
But don't start that at a ride. Have your horse used to eating that at home all the time as a regular thing. Don't experiment with things like beet pulp at a ride. Only do what your horse is accustomed to.
I agree.
Okay, then Kay, the next question is, I've never had trouble with colic at home, except he overheated at a CTR once. Ever since then, if he gets too hot, he acts colicky. What can I do to help with this?
Yeah, and cooling, these big, heavier muscled horses have a harder time staying cool. And so I know I have to work really hard to keep my horse cool. She wears a white blanket to reflect the heat. We're pouring water on the major blood vessels, on her jugulars, the inside of her legs, inside of both the front and hind legs, all those helping to keep her cool during a ride. I stopped at every stream, if there was water available, you'd have to scoop it out. You don't want to contaminate the water source for drinking, but use that water to help with cooling as well with the sponge, or teaching the horse to just be sprayed on them directly. So it does take some work at rides, and I can sure talk to people individually about that as well.
And that's a horse also who may need electrolytes. You want to make sure the horse is drinking if you're going to be feeding them electrolytes. But those horses that really get overheated, you want to begin to condition them with using electrolytes also. So the question of, do you adjust electrolyte levels according to how much they are sweating? Absolutely. And if it's a cool day and you're starting out at first light at 6 a.m. and it's overcast and your horse is barely sweating for the first 4 hours of the ride, that horse doesn't need any electrolytes then. On the other hand, if it's hot and humid in Alabama and it's 10 o'clock in the morning and it's already 90 degrees, those horses may need electrolytes all throughout the ride. Just remember that you can't make your horse drink. And if you keep giving him electrolytes and keep giving him electrolytes and he never drinks, you could be pushing him over the limit for his electrolytes. And you want to get some advice from the veterinarian at the ride about that if that's happening. Okay. How are we doing for time, Bill?
I think we're doing fine on time. It's I think I guess you kind of answered both these last questions the last shot.
I have this last slide that these were some of the questions that were sent in and were sent to, I kind of grouped them together that were sent in to Sarah or Jamie or Bill. Somebody received some of these questions. We already talked about electrolytes. There was a comment about should horse owners have Banamine in their emergency kit. I think we kind of touched on that a little bit. I do want to mention something that the person who asked that question asked it if they should have electrolyte or if they should have Banamine shots with them for their horse. And let me just tell you, please, never, ever, ever give your horse an injection of Banamine in the muscle.
Yeah.
I know there are a few veterinarians around who will do that. You are really playing with fire to do that. Banamine needs to be given cleanly in the vein if you're giving the injectable product. I've seen too many horses ruined, and I had a horse nearly die from getting a Banamine shot in the muscle. There's nothing wrong with the shot. It's not contaminated. It's normal Banamine. It's just really not meant to go in the muscle. So the only Banamine that that I'm sure Kay and I both would advise you to have on hand for you would be the oral Banamine. And I think the paste is easier than the pellets, but only if you are going to give an intravenous shot should you have injectable Banamine, I think.
I've definitely been at rides where different riders carried injectable Banamine, but usually the riders were asking me as the vet to give it. You know, most people didn't feel comfortable with that, and I'm kind of glad that I was involved with the treatment of this horse.
Yeah. You may find that not all veterinarians would be willing to do that. If you hand me a clear, colorless liquid in a syringe and say, this is Banamine, and would you give this to my horse in the vein? Right. I'm going to say, sorry. Let's get a labeled bottle of Banamine
right.
so that I know what it is. That's
not expired.
Yeah. Yeah. Okay. And then someone had asked, after the colic episode has been treated as needed, can I take my horse for walks or even lunge? I think that maybe was supposed to be lunge my horse.
Lunge, yeah.
After the horse has been pulled by the vet or me by my personal choice from competition to exercise her. Kay, do you want to field that one?
Yeah, I mean, because I have definitely been at rides where there was a horse that colicked, it was treated, and it recovered. It was a mild colic, but they were out of competition. And then they've even asked, can I ride the next day? And, you know, we don't want to push the horse because that horse has already showed us that it was sick. But a little bit of exercise is not going to hurt them. You know, hand walking and lunging, that shouldn't hurt them.
Yeah, I agree. Okay. Any more questions?
Dr. Hess, Dr. Gunkel, thank you for this. Thank you for this talk. It's very much appreciated. It seems we're done with questions. For those of you who are still online, please remember there will be another talk next month. It's going to be on what to do at your first Natrac ride. It's probably most of you already know the answer to that, but if you have friends, people who are interested in the sport, that'll be one of the webinars that is open to everybody. You do not need to be a member to attend that webinar. Please drag in your friends, have them listen to it, and we hope to see you online next month.
Thanks, Bill, for lining up these webinars.
Very good. Thank you so much, everyone. I hope that you had all your questions answered and you feel a little more comfortable about your horse and colic, and hopefully you won't have to experience it personally with your animal. So thank you, everybody, and good night. Kay, thank you so much. Good to see you again.
All right. Thanks, Pam.
Bye-bye.